benefits of inducing labor are a nuanced conversation between you and your team about when is it safest for the baby to stay inside and when is it safest for the baby to be on the outside. So one reason that we would recommend induction is if you go a full week past your due date, then your placenta gets older, it's not as good at giving oxygen to the baby, and your risk of having what's called an intrauterine fetal demise or stillbirth goes up exponentially after those first 7 days after the due date. And so that would be one reason we would recommend an induction. Other reasons to recommend induction would be things like elevated blood pressure, gestational hypertension, or preeclampsia, sometimes gestational diabetes because the risk of the baby getting bigger and having problems managing their own blood sugars on the outside become an issue. And also, again, it goes back to the health of the placenta. So in all of these conditions, we really are wanting to help you go into labor when your placenta is really healthy and can handle the stress of labor. And so sometimes that's been shown to be earlier, 39 weeks, in some situations 38 or 37 weeks gestation. The other reason to have an induction might be because you live really far from the hospital and maybe you had your last baby really fast and you don't want to deliver your baby at home. And so you would come to the hospital and have your labor induced so that you know that you'll make it for the delivery. The risks of a labor induction would be very similar to the risks of a natural labor. When you're having natural labor, you're gonna stress the placenta with every contraction. The medications that we give you for induction are also going to make your uterus contract and stress your placenta some too. So the risks would be very similar. I think for induction, depending on medications, some might cause nausea or elevated temperature or painful contractions, which we actually want. Those are some of the things that I think about as downsides of the induction process.